and welcome to today's edition of the Research Sofa. Today I'm talking about the importance of physical health in imprisoned women with severe mental ill health. So today I've got with me Carolyn Chew-Graham, who's a GP and Professor of General Practice Research at Keele University, and she's the co-lead of the Closing the Gap Primary Care Special Interest Group. With Carolyn on the sofa, we've got Tammi Walker, Professor of Psychology and Research Director of the Centre for Applied Psychological Science at Teeside University. And also I've got Joyce Callaghick with me, who's Director of WISH, a women's user-led mental health charity. So I'm just going to pass you over to Carolyn now, who's going to chair today's session and chair the discussion on the importance of physical health in imprisoned women with SMI. So over to you, Carolyn.
Thank you very much, Emily. Welcome, everybody. And some of us are on sofas, some of us are not. We all know that people who've got severe and enduring mental health problems face a future limited by stigmatising psychiatric illness, but also physical health problems. There are society and behavioural determinants of these physical health problems. People may have lifestyles that increase their risk of cardiovascular morbidity, smoking, low activity, poor diet, and financial difficulties. The people have these conflicting comorbidities, their long-term mental health condition, and problems accessing care for both those. Often people are not looked after in a holistic way. They may receive fragmented care, and parts of their care may completely drop off the horizon altogether. All of these factors mean that people with severe and enduring mental health problems will have a life expectancy of 15 to 20 years, less than somebody who doesn't have such severe mental illness. So on top of this, the subject of today is women who are in prison have got a further impediment to them receiving good quality care for both their physical and mental health. I'm going to introduce Joyce now, who's going to talk about WISH.
Oh, thanks, Carolyn. Well, WISH is quite unique, really. It's a women's user-led mental health organisation. We provide long-term, gender-sensitive and trauma-informed support and advocacy to women on their journey through the prison, secure hospital and into the community. We campaign as well, and we aim to empower women to have their voices heard at a policy level. We just developed our new theory of change for our services and campaigns, and that is about developing positive pathways for women with complex needs, multiple disadvantage, histories of abuse. And we want to work with women to find their ways forward, building on their strengths and their aspirations, their needs and their ambitions. And we aim to give all women some influence over their lives. We want to support them to build their self-esteem and self-confidence. And as we're a user-led organisation, the recognition of that peer support is greatly appreciated by women. Thank you.
Thanks so much, Joyce. So the Closing the Gap network aims to work around and aiming to reduce the mortality gap that exists in people with severe and enduring mental health problems. And you might think, well, what's this got to do with imprisoned women? It's something that we've never tackled before. And you might think, what's it got to do with primary care? But actually, women in prisons should be in receipt of primary care and whilst they're imprisoned, but also on discharge. So the primary care special interest group has thought that this might be a really good sort of research to get involved with to try and improve care of women in prison. And I'm going to hand over to Tammi, who's going to talk about our recent success in funding.
Thanks, Caroline. Yeah, so Caroline and I have been funded by the Closing the Gap Collaboration Fund, and it was to develop work around improving this very important area around physical health and in prison women with serious mental illness. So in October, we held a stakeholder group with a number of participants. We had people from Praxis Plus, Keele University, Newcastle University and Teeside University, and Midland Partnership Foundation Trust. Basically, what we did in this session is that we held a number of conversations about this very important area. And to further illustrate this, we had Tom Bailey, who illustrated this work with some fantastic illustrations to summarise our meeting. What we did is, in this meeting, we reflected on what we think the problems are and the barriers to developing good quality physical health care for women in prison. And we also tried to identify what would be the priority areas for further research in this very important area, and how we could take this forward and apply for future funding as well. I'll pass you back over to Carolyn now.
Thanks, Tammi. So during the meeting, we discussed what we mean by SMI, severe and enduring mental health problems, or severe mental illness. And the CTG tends to focus on schizophrenia and bipolar disorder. But actually at the meeting, participants all said we should be considering also women who've got emotionally unstable personality disorder. It was considered by participants that the problems are the same. They're on drugs which might be causing cardiometabolic problems. And actually diagnoses tend to be fluid. So somebody might have a diagnosis of EUPD, but in the background, they might have had a diagnosis of schizophrenia or bipolar disorder. So that's something that we're taking forward into consideration. Tammi's going to talk about the work we're going to take forward.
Yes, on the back of this, what we are planning after this, after the stakeholder meeting, we've agreed that we'll take 2 pieces of work forward. And we're going to be holding 2 further workshops. The first workshop will be in December, and that'll be exploring what are the experience of imprisoned women with SMI and physical health problems. So we're wanting to find out from this session though, what is currently working. So what's good practice at the moment, but also what could change. So what could we develop to make improvements in this area? The next one that we'll also be looking at in the next work group would be we're hoping in January. And that's going to be looking at a piece of work which has been put in place by Practice Plus, and that's what it's to evaluate a piece of work which is the Health Champions work, what's been undertaken in some prisons down in the Midlands area in terms of that. So what we're planning then from that, then once we've got these ideas, is after these 2 further workshops and really working with a number of participants in 2 working groups, we'll then be putting in some funding applications from that.
Thank you so much for that really good summary. Joyce, I wonder if you want to reflect on the priorities that were chosen at the meeting.
Well, absolutely. Obviously, women's physical health is often not acknowledged as an important priority within the criminal justice system. So starting with research to explore women's experiences is vital, because often their voice just isn't heard. And if you're just a group of professionals, sort of presuming then that's just not good enough. So having women express their enabling women to express their needs and their aspirations is very important. And also, we talked about the Health Champions role, which seems to be an incredibly successful intervention, but to really understand, why it's having such a beneficial impact is extremely important. And it's important for our group to look at how we can build on that and take it forward. Yeah.
Thanks, Joyce. So we're really excited about developing new work around women with SMI in prisons and aiming to reduce the mortality gap. If you're interested in our work and our research, then please contact one of us. And if you're interested in joining the CTG Primary Care SIG, please contact myself or Emily. Thank you so much for listening.
Thank you.